Welcome to today's webinar hosted on the NCTSN Learning Center for Child and Adolescent Trauma. My name is Jennifer Grady and I'll be facilitating today's webinar. First, I'd like to review some technical points. If you experience technical difficulties at any point, you may email us at help@nctsn.org. The format of this training does not allow for you to speak directly to the panelists. However, we encourage you to use the Q&A feature on WebEx. We'll try to answer questions that are submitted during our question and answer section of the webinar. Today's webinar will also be archived on the Learning Center website. That makes it possible for you to view the presentation at a later time, as well as complete a short evaluation, the CE post-test, and print a CE certificate at any time. For anyone wishing to receive CE credit for this training, no hard copy certificates will be mailed. The National Center for Child Traumatic Stress is approved by the APA, National Association of Social Workers, and the National Board of Certified Counselors. Today's webinar, Affirming Care for Transgender and Gender-Expansive Youth, is the second webinar in the Transforming Trauma in LGBTQ Youth webinar series. The learning objectives for today's webinar. After today's webinar, we hope that participants will be able to have a better understanding of the language of gender, gender identity, and gender expression, build awareness around the types of trauma that transgender and gender-expansive youth are affected by most frequently, and gain techniques for building an affirming practice and supportive culture when working with transgender and gender-expansive youth who experience trauma. We have a wonderful group of presenters joining us for today's webinar. Kaylee Lowndes, preferred pronouns she, her, and hers, is an LCSW and is the Director of Connections Foster Care Programming with Hillside in Atlanta, Georgia. She's been working in the field of child welfare since 2008 in a variety of settings, including residential, outpatient, community settings, as well as therapeutic schools and juvenile justice facilities. Kaylee's expertise focuses on program development, foster and adoptive care, and LGBTQ affirming care. Our second presenter is Sabrina Matheny. She's an MSW and an LICSW. Her preferred pronouns are she, her, and hers, and is the Director of Youth and Family Services at the Human Development Center in Duluth, Minnesota. She also provides training, organizational consulting, and expert testimony around issues of traumatic stress. She was the clinical program manager at the AMBIC network at the University of Minnesota, which is a National Child Traumatic Stress Network site. In addition to psychotherapy for traumatized children and their families, Sabrina has a particular expertise in sexual abuse and pediatric sexual behavior. Megan Mooney is a PhD with preferred pronouns she, her, and hers, and is a licensed psychologist who specializes in working with children and families. Dr. Mooney has focused on serving traumatized children and families for 15 years and has a specialty interest in working with LGBTQ youth who are disproportionately impacted by a variety of traumatic experiences. She provides therapy and psychological assessments for children and adolescents. Andrew Weinberg is an LCSW with preferred pronouns he, him, and his, and is the clinical supervisor at PERSAD Center in Pittsburgh, Pennsylvania, and has been at PERSAD since 2014. He has been providing LGBTQ+ affirming therapy for over 15 years in both New York and Pennsylvania. Earlier this year, Andrew became the first therapist at the PERSAD Center to become a board-certified transgender care therapist. He also has a background in working with children, adolescents, and families. I'd like to now hand over the presentation to Kaylee Lowndes.
Hey everyone, thank you all for coming and listening in with us on our webinar this afternoon. We want to acknowledge that we all have individual identities and experiences, which you'll be able to see on the slide we're looking at right now. We will be doing our best to focus on the intersectionality and multiplicity of all facets that build and make us who we are. We come to this presentation with our privilege and our desire to do better as providers through learning. We hope to impart with you what we feel knowledgeable about regarding the care for transgender and gender-expansive youth. We welcome your feedback and opportunities for learning that we did not include in practice and which we can engage in the future. And I will pass it along to Andrew.
Hi, everyone. Thanks all for being here. So you've heard a little bit about who we are. You can skip to the next slide, please. So like I said, you've heard about who we are, and so we're interested to hear who you are. So we have a question for everyone. What role most closely represents your job and responsibilities? And you can go ahead and respond to that question. If you picked other, please feel free to write in what the other is.
So about 15 more seconds, and then we'll close the poll.
Okay. All right, so looks like we have mostly therapists. So that's really awesome, and some direct care folks, some administrators, organizational leaders, and some others, and some folks who did not respond. Okay, so you can skip to the next slide. All right, so another question. What is your experience level? How much experience do you have working with transgender and gender-expansive youth? Again, please feel free to respond to the poll. Okay, so I got another variety. So some with no experience, some with a little, some moderate, and some experienced folks. So we got a nice mix of people. Okay, so let's go to the next slide, please. Okay, so real quick, we'd like to just go over the 6 principles of trauma-informed care. So these include safety, trustworthiness and transparency, peer support, collaboration and mutuality, empowerment, voice and choice, cultural, historical, and gender issues. And this comes from the SAMHSA's Trauma and Justice Strategic Initiative. Next slide, please. Okay. So here is a sort of handy graphic that kind of puts a nice picture on what we call the transgender umbrella. So lots of different identities can fall under this umbrella, as you can see in the graphic. And this webinar is going to focus on advanced learner practices. So we're not going to go too in-depth in terms of definitions. There are some definitions at the end. If you are unfamiliar with the term, check out the link in the chat box where you can find a link to our learner dictionary. Next slide, and I will pass it over to Kaylee.
All right, so we do want to, while we're not going to be going deep into definitions or terminology quite yet, we are going to just make the point of noting that gender does not equal sexuality. Individuals have their assigned sex, normally assigned by a medical practitioner at birth. They have their gender identity that is formed through kind of their younger developmental years. And you can see the different categories or forms of identity that someone might have in each of these categories. We also outline gender expression and the sexual identity and orientation, really just to show how there's the whole spectrum of identities and they are not synonymous with each other. And you'll see at the bottom kind of what crosses all barriers are queer and two-spirit. And so we want to highlight that in different cultures, there are different ways to engage with sex, gender identity, gender expression, and sexual identity and orientation. And we want to remind participants that you should be allowing space for yourself and for others that you work with and care for to make errors. None of us are perfect. We're all on varying paths for growth and learning. And so, you know, if you make a mistake, if you're maybe not familiar with what it means to operate in a non-binary gender system, if you've only been familiar with masculine or feminine and not necessarily androgynous or gender expansive, that kind of looking and doing your own research to moving beyond the binary gender system. And as a provider, if you're uncertain in working with a client who's transgender or gender expansive, make sure you have resources and other individuals you can consult and kind of explore with, because we want to make sure that if you're feeling challenged in your work, you're always seeking consultation or supervision from someone else. And we do encourage you to use the chat box to present any questions. This way we can ensure we get through all of our material and we can try to address anything that comes up for you guys. And so kind of breaking down these different categories a little bit more, we'll also look at our favorite gender unicorn graphic.
Okay, so the gender unicorn. This is actually a free graphic that you can go download on the internet. I believe the link is listed on the graphic. But this gives you a really nice way to sort of think about and break apart gender identity, gender expression, sex assigned at birth, physical attraction to, and emotional attraction to. When you're working with clients, this graphic can be useful can be used as a tool to help clients sort of self-identify their identity without us making any assumptions. Because really, we're not here to tell people who they are. That's not our place. But this graphic can help clients understand the flexibility in the different constructs and each individual person's identity. So, you know, gender and sexuality, two separate things, but fluid, right? So people can sort of move back and forth from left to right at different points. You know, I think a useful thing to keep in mind is, you know, how somebody identifies today might look very different from how they're identifying tomorrow or the next day or the day after that. A question to think about: why is it problematic to try to guess what someone's biological sex might be based on their identity and expression? Well, that, again, it's based on an assumption, and assumptions are usually flawed. Sometimes we can, you know, look at a person and have a sense of who this person is, but until they tell us, we don't really know. Like was said before, the three things aren't dictated by one another. So what my gender identity is does not necessarily mean what my gender expression is going to be, does not necessarily have anything to do with what my sexual orientation is. And then the last point, even if someone is super far on the left on two things, you still can't assume where they will land on the third. So I think the takeaway to all of this is to ask, you know, show this graphic to a client. Where do they feel like they fit on this scale? And go with what the client tells you without trying to make any assumptions along the way. We can move ahead.
All right, and so we want to talk a little bit about kind of what are the different ways in which someone can transition. So they may begin their transition including either social or potentially a medical transition. And transitions look different for every person. They may vary in length of time. A transition could be rather quick for some and then take years for others. And so mental health, primary care, hormone therapy, and surgery, those are all aspects of which could be included in someone's social or medical transition. Some individuals may choose to transition socially and not medically, and some folks may choose to transition socially with HRT, which is the hormone replacement therapy, but then not have surgeries. It's important to note that every person's transition is what is right for them, and that we as providers need to be here to help them and their chosen family along on that journey. For those of you that aren't familiar, a social transition frequently refers to the non-medical decision in which a person begins the process of changing how they would like to present, how they envision their future gender presentation. This can include changing first name, pronouns, hairstyle, and clothing to live everyday life as one's actual gender. And it's also important to remember that like accessing things like primary care, mental health care, hormone therapy, and surgery, those are all based on if someone has insurance, if they have the money to pay for services, and if they have access to care. Transgender and gender-expansive individuals frequently experience discrimination when accessing health care. This can be from disrespect and harassment to violence and outright denial of service. So when trans and gender-expansive individuals have reported barriers to care, we want to make sure that with these realities, we kind of work on disseminating information to avoid provider ignorance about the health needs of our clients. And so when we're working with our clients as an affirming practice on this slide, and you'll see throughout the presentation different affirming practice bullets, it's important to help your client find out who the knowledgeable and affirming providers are in your area to help them with their care. And it is important when working with trans and gender expansive youth that we keep a trauma-focused lens. And so we also want to look at the intersection of trauma and gender identity in youth on our next slide. Transgender and gender expansive youth experience the same type of traumas as any other youth, like maltreatment, domestic violence. They could experience car accidents and natural disasters. However, they're also experiencing that added layer of discrimination and rejection from family members, peers, teachers, community members, due to their perceived gender identity and expression. And like Andrew said, like we don't want to make assumptions, and so it's really about the work to make sure we're working with our clients so that they feel heard. With the added risks of these additional traumas related to their gender identity, youth are often at an elevated risk for developing negative mental health outcomes and for engaging in substance use or abuse, experiencing homelessness, and considering or attempting suicide at a higher rate than their peers who do not identify as transgender or gender expansive. And we want to remember that with proper supports in schools, within the home, and within the community, providing clinical support to families, we have seen an increase in family acceptance, which also kind of helps to provide resiliency and other positive factors for our young people. And I'm going to turn it over to Megan to dig a little bit deeper into all of these risk and resiliency factors.
All right, thanks, Kaylee. So as Kaylee mentioned on the last slide, one of the areas in which our gender diverse youth often experience trauma is at school. And so data collected from current LGBTQ high school students in biannual surveys that are conducted by the Gay, Lesbian, Straight Education Network reflect that nearly all the students that have identified as transgender had heard negative remarks either about their own gender expression or that of other peers. And unfortunately, most of these students have also heard such comments, not just from students, but from their teachers and staff as well. Next slide. So GLSEN's data also reflect discriminatory practices by schools against transgender and gender diverse students, specifically based on their gender identity and expression. This includes policies prohibiting use of young people's correct name and pronouns, bathroom use, locker room use, and even the clothes that they wear that don't seem to conform to others' expectations for them. And so one thing that we all should be looking to do as an affirming practice is to help the youth and their families being able to advocate for their rights in schools and connecting them to services to help them advocate in that setting. Next slide. The kinds of data found in GLSEN surveys are also supported by data from over 6,000 transgender adults that have completed the National Transgender Discrimination Survey. This survey has indicated that the majority of these people have experienced some form of harassment while they were in school. And about a third of those suffered some form of physical assault, and many, unfortunately, also experienced sexual violence in a school context. Next slide. Moreover, the majority of transgender adults have reported a lifetime of serious discrimination and traumas that include not just school-based experiences of traumas like we've been talking about, but also problems with accessing appropriate services, homelessness, and even incarceration. Next slide. So research really shows us that all these kinds of traumatic experiences that gender diverse youth experience in school settings lead to a variety of negative school-related consequences. These young people miss school, they have lower GPAs, they don't go on to post-secondary school as often as cisgender peers. And there's also a number of negative psychological consequences, such as depression, low self-esteem, self-harming, and suicide attempts. Next slide. Research shows us that gender nonconformity is related to increased risk of experiencing trauma in LGBTQ youth. So what this really means is that kids who don't look like they should, in quotes, experience all forms of abuse and harassment at rates that are higher than their peers. This actually holds true for kids even if they are cisgender and heterosexual. These high rates of abuse are then in turn related to more symptoms of depression and PTSD in these young people. So again, as we've been mentioning before, it's important that we not make assumptions about a young person's gender identity or sexual orientation simply based on their outward expression or appearance. Next slide. So in terms of some treatment considerations, given the complexities of the intersection of trauma with gender identity and expression, it's important for providers to be reflective when asked to work with these young people. Providers have to be aware of the limitations of their own knowledge, their own personal biases and preconceived notions, as well as resources for seeking out additional supervision, consultation, and training as appropriate. So this slide gives some examples of some questions that providers really should consider when working with gender diverse young people. Next slide. And so for those of us that work in facilities such as residential treatment settings or group homes, juvenile justice settings that are often divided by client sex, there are a number of challenges specific to gender diverse young people being able to maintain privacy, safety, and dignity in these settings. So we also want to be aware just kind of institutional settings that might create further difficulties for young people seeking treatment. Next slide. So when you are examining your own capacity and competency to treat gender diverse young people, you might want to also consider the broader cultural issues that could impact your work. For example, some young people face discrimination from community mental health providers who are not focused on LGBTQ work. They may have previously been given false information or even denied services. Also, if providers are not comfortable asking about and assessing for the potential role of gender identity in traumatic experiences, they might miss important and affirming aspects of treatment planning. Next slide. Further, some LGBTQ agencies may not have clinicians who are trained in trauma-focused and evidence-based interventions. Thus, our youth may have received treatments that were not appropriate for their needs based on a history of traumatic experiences. So we want to be sure to consider a young person's gender identity and expression as well as trauma history to be potentially relevant. We always want to ask a young person rather than making assumptions. And NCTSN has been working on a screener to help providers with these conversations, and we'll be talking more about that towards the end of this webinar. Next slide. As Kaylee referenced earlier, an important consideration in our treatment planning for gender diverse young people who've experienced trauma is the role of their family. As she mentioned, research shows that many transgender adults report experiencing family rejection, which have led to a variety of negative behavioral and health outcomes. However, research from the Family Acceptance Project has also shown that the inverse is true, that having even one accepting family member dramatically reduces the likelihood of negative outcomes, such as high-risk sexual behaviors, substance abuse, and suicidal ideation. Thus, just like we want to include caregivers in trauma-focused work with young people, it's important to consider how we might foster or enhance relationships with accepting adults in the lives of gender-diverse young people as one element of our treatment. And now I'm going to hand it over to Sabrina to give us some more ideas about that.
Thank you. So as we look at treatment for youth, one of the questions we have to ask ourselves is, are our organizations trauma-informed, and do they create a climate where gender-expansive youth may feel comfortable participating in services, seeking services, and it speaks to them and their identity. And as people enter into organizations, families and youth are likely to interact with a number of people other than the provider that they have been referred to see. And so it's important for our organizations to really ensure that we train and we train people on the very front lines who take those initial calls in being supportive and affirming. Our organizations are part of the solution of normalizing different identities or part of the ongoing social bias when promoting a dichotomous view of gender. And so we want to ask ourselves, are our websites, brochures, emails, our publicity materials, what do they say about our organization and the environment it creates for gender-expansive and transgender youth? And looking at the entire climate, how do we communicate that individuals are welcome in our facility? How do we make sure that it's not just the right people who, quote unquote, the right people within the agency who provide those specialized services that are informed and that expands to everyone? And our affirming practice, does your organization's marketing and education materials include services and images of gender nonconforming individuals? Another one that we'll talk about a little bit later is, how does everyone become aware of asking individuals to self-identify their gender or their preferred pronouns? And so I will pass it back to Kaylee.
We also want to acknowledge how the current socio-political context impacts resources and supports available for our trans and gender-expansive youth. As providers, we need to be aware of how different geographic regions have varying cultural values, belief norms, all of the things that impact our youth and families. What may be available locally may not actually be adequate care for the children or teens who access services. And really, right now, young people are experiencing a world where they have constant access to a 24-hour news cycle, social media, and online platforms. I'd say this allows them to access an increased group of peers who may have similar identities. However, it also increases exposure to bullying, hate, and what the young people refer to as online trolls. This is where we see our kids being told negative things about them and harassment online. And so we also want to note that if we want to acknowledge how systemic oppression also impacts a person's decision to access services, or if they even have the emotional energy to engage. A client needs to feel safe and that they have reliable supports. And having conducted several transgender youth focus groups about how to improve care through several different organizations, every single time we've done these focus groups, youth want to see someone who is providing care for them that looks like them, that has gone through the same lived experiences, or who has similar experiences to them. So we as providers need to be cognizant of how our identities and life experiences shape our worldview and how that may influence how a client views us as well. We really need to make sure that within our organization we're providing access to care. Do you feel like we have open and available services, and can they come in and actually talk safely about what they're enduring either at home or in the community? This is really about being trauma-informed and thinking about cultural trauma and messages they're receiving from society at large. And so with that, we also want to talk about what does it mean to find the right provider. And so doing that, kind of looking at who and what is available in your area, this can sometimes be a challenge depending on where folks live. A lot of times, trans and gender-expansive youth, young adults, and family members are asking around, and word of mouth is sometimes the best way that people are actually trusting that the provider they'll be sent to is a safe resource. So this is something that when you're networking, when you're working within the community, like what do people know about you and what do you know about other people? So connecting with other local providers is something that can be helpful. And something you can do to help your clients find a provider is actually call an office and speak to a receptionist. So some of the questions you can ask are, do you serve cis and transgender individuals? How long have you been serving trans clients? Do you conduct and read lab work on site, or do you refer out for services? What type of training do your front desk, your nursing staff receive? Are the medical providers or any of the providers within the clinic or facility planning on taking leave anytime soon? Because we want to be conscious that we're not sending a client to a provider to find out that, oh, and they're going on medical leave or maternity leave within the next month, and then your client will have to start over with a new practitioner. A lot of times, depending on the client, what type of insurance do they take or do they have? Are there any providers in your area that actually do kind of free walk-in work? And kind of what does that look like for the clients you serve and the families? And it's also important to ask providers maybe how many trans and gender expansive youth have they worked with? Will this be their first client? Does their facility have gender-neutral bathrooms? And what type of electronic records does the organization have so that the client isn't going to get misgendered or using the inappropriate name when they come there? Also, understanding if an organization has a non-discrimination policy is really important. So once you've found your provider, we can also then look at, like, what is the role of a clinician in working with trans youth? And so clinicians working with our trans and gender expansive youth want to maintain that strengths-based and trauma-informed lens. The therapist should really strive to meet the family where they're at. You want to start where the parent's current level of knowledge, the client's current level of knowledge, their attitudes, expectations, and beliefs about a child's gender identity. That's really kind of where you get to the base of, like, what does it mean that we're providing care for these children and families? If we don't know where they're at and where they're willing to go, we can't really make progress within therapy. Evidence-based psychotherapy, such as trauma-focused cognitive behavioral therapy, is one of the first lines of treatment for youth who have PTSD and other difficulties. However, we really need to make sure that any treatment we're doing, we're tailoring it to meet cultural, developmental, family, and individual needs. And a couple of the webinars that we'll talk about later as a part of these NCTSN series will both go into trauma-focused cognitive behavioral therapy and family acceptance therapies. And so we really want to work with our children and families to make sure that what are we doing, how are we meeting them where they're at. A lot of the work you're doing may be including psychoeducation. You're going to be working to make sure the family understands what are risk factors, what are the things that will help prove outcomes for your child, what could the child be experiencing in the community, and also teaching the parents how to be an advocate for their child in the different arenas of their life. And you can also work to find different support groups either in the community, in the child's school, or even if there are opportunities within your own kind of network or mental health provider clinic for groups or peer-based work. And with that, I'm going to pass it on to Andrew.
Okay, thanks, Kaylee. So I'm going to be talking a little bit about competencies of a clinician. And we have some just basic recommended minimum credentials when working with trans and gender expansive youth. The ability to recognize and diagnose coexisting mental health concerns and to be able to distinguish these from gender identity. Be knowledgeable about gender expansive identities and expressions and the assessment and treatment of gender identity related concerns. And lastly, be able to engage in continuing education and training to improve practice and remain up to date with research. One thing that we do know is that when it comes to things like language and terms, these are things that are constantly in flux and are constantly changing. And so so to speak, what the kids are saying today might be different from what the kids are saying tomorrow. So it's always good and helpful to just be kind of as up to date as you can on terms and knowledge. I'm going to talk a little bit about WPATH. WPATH is the World Professional Association for Transgender Health, and they put out what's called the Standards of Care. It's important to note that the Standards of Care are not law. It is sort of it's a guideline. And in that document, which can be accessed on the WPATH website, if you go to www.wpath.org, I believe it is, you should be able to find it. I believe they are on version 7 right now. And in that document, it really outlines what the standards of care are for various different medical procedures. So getting familiar with what those guidelines are and what those standards are can really be helpful in working with youth who may be interested in medical interventions. In addition to being aware of WPATH, it's also really suggested to get additional training and to be engaged with other competent providers. Sometimes the best teachers are our peers. Sometimes our best teachers are our clients, and so to really be open to hearing from everyone. Just a quick statistic, 13% of people who responded to a report reported that one or more professionals, such as psychologists, counselor, or religious advisors, tried to stop them from being transgender. So if we're thinking about this in the context of affirming care, that's not really being affirming. And so our role is to try and help people get the things that they need, right? And so we don't want to be sort of standing in their way or using our own judgments or beliefs or biases to dictate what another person should or should not do. It's also noted that there are no standard set of sessions for a client to go through in order to receive a letter, not whether it's a letter for hormone replacement therapy, a letter for chest reconstruction, or a letter for gender confirmation surgery. And actually, in the newest version of the standards of care, a letter is not required to go on HRT. However, like I said before, it is not law. So that means that a doctor could still request or require a letter. Hopefully that's not, I didn't say that in a confusing way. Some other additional qualities, if you will, for competencies in terms of clinicians, a master's degree or its equivalent in a clinical behavioral science field. This degree or a more advanced one should be granted by an institution accredited by the appropriate national or regional accrediting board. The mental health professional should have documented credentials from a relevant licensing board or equivalent for that country. When you are writing letters for clients for different medical interventions, sometimes depending upon the insurance company, they might require that the letter be done by a PhD or a psychologist, sometimes a psychiatrist. So depending upon the insurance, that might dictate who needs to be signing the letter or doing the letter. Another competency is to be familiar with the Diagnostic Statistical Manual of Mental Disorders, or the DSM, and or the International Classification of Diseases for diagnostic purposes. Also, the ability to recognize and diagnose coexisting mental health concerns and be able to distinguish these from gender identity-related mental health concerns. This is an important point because it's not uncommon for people to assume that someone's gender identity is a result of some other mental health issue or because of a trauma. And I'm not saying that they never are connected, but you don't want to sort of make the assumption that they are connected. Work with your client, listen to your client, use your skills to help sort of make that determination. You also want to have documented supervised training and competence in psychotherapy or counseling, so that could be trauma-informed care, that could be transgender training or gender training in general, getting as much training so that you feel as competent as you possibly can be. Also being knowledgeable about gender nonconforming identities and expressions and the assessment and treatment of gender dysphoria. So not everyone identifies as strictly male, strictly female. There's a lot of folks who identify as what's called non-binary. And so we want to make sure that we don't disclude folks who may not identify on the binary and make sure that you're being inclusive of everyone. Getting continuing education in the assessment and treatment of gender dysphoria. This could look like relevant professional meetings, workshops, or seminars. I mentioned WPATH earlier. WPATH is in the process of creating like a certification program. The certification program that I went through was through the International Transgender Care Association. And they have really good trainings where you can learn more about gender nonconformity, gender dysphoria, and other aspects of transition. In terms of competencies specifically related to the treatment of children and adolescents, it's very important to be trained in childhood and adolescent development, and be competent in diagnosing and treating the ordinary problems of children and adolescents. So with all of that said, it's recommended that mental health professionals develop and maintain cultural competence to facilitate their work with transgender and gender nonconforming clients. This may involve, for example, becoming knowledgeable about current community, advocacy, and public policy issues relevant to these clients and their families. Additionally, knowledge about sexuality, sexual health concerns, and the assessment and treatment of sexual disorders is preferred. Okay, next slide. Assessing children and adolescents. Intentionally express a positive and affirming attitude towards gender-expansive identities. So you might want to go, it might be helpful to go a little bit out of your way to express an attitude of warmth and positivity and affirming attitudes, just so we let the clients that we're working with know that we're open to everyone. Offer a thorough assessment for gender identity-related concerns and any coexisting mental health concerns. On the intake that we use at my agency, we have an entire section dedicated to gender identity, where we ask various questions like, how do you identify? How old were you when you first came into this awareness? What was the coming out process like? What are your goals? And this really gives you a nice sort of understanding of who this person is, where they're coming from, and where their goals are and where they want to get. You're also going to be educating clients and their families about different therapeutic options. So this may be sort of specifically focused around gender and transition, but it could also be focused on interventions for PTSD or depression, anxiety. So we want to be able to provide clients and families with a variety of intervention tools. The assessment phase should also be used to inform youth and their families about the possibilities and limitations of different treatments. As a mental health provider, I don't believe we are expected to know all of the detailed in and outs of things like medical transition, but we do want to have a somewhat basic understanding, and if we don't know the answers to questions that clients or families might have, we want to be able to provide resources where they can find those answers, or possibly we go and find those answers and then provide them at a later time. Okay, so now we can go to the next slide. All right, treatment considerations for children and adolescents. Gender identity and expression in children versus adolescents. Different developmental stages that people might be in could influence or be a factor in how people identify and express themselves. And so being aware of what developmental level a kiddo is at can be particularly useful. Children as young as 2 may show features that could indicate gender incongruence with their assigned sex at birth. And so social transition could be something occurring in early childhood. Not all trans and gender fluid adolescents have a strong wish for hormones and surgery. that's an important assumption, again, not to make, that because somebody is trans and or gender fluid, that they're going to necessarily want to have medical interventions. It is more common for adolescents with gender identity concerns to have coexisting internalized disorders such as anxiety and depression. And they don't have, it's not that they have anxiety and depression because they're trans or gender nonconforming. I think it's more helpful to think of it in the context of the world that we live in and the kinds of discrimination that folks experience and how that really is what leads to things like anxiety and depression. Okay, so just a couple of other points. Not all children outwardly express dysphoria pre-puberty. They do not have a strong insistence that their gender does not match their assigned sex until they hit puberty. For the most part, before we hit puberty, our bodies kind of look the same. And so those differences may not become apparent until a kid starts hitting puberty. And so it's not uncommon to see the presence or spike in dysphoria as puberty is starting and progressing. Kids sometimes don't have language around their gender until they hit puberty. And again, this can be when dysphoria really kicks off. These are children who may have identified as gender expansive as a child, but did not experience any of the significant dysphoria until puberty begins and they experience higher levels of distress. In some follow-up studies of prepubertal children, this was done mainly with folks assigned male at birth, who were referred to clinics for assessment of gender dysphoria. The dysphoria persisted into adulthood for only 6 to 23% of children. Boys in these studies were more likely to identify as gay in adulthood than as transgender. Newer studies, also including girls, showed a 12 to 27% persistence rate of gender dysphoria into adulthood. In another follow-up study of 70 adolescents who were diagnosed with gender dysphoria and given puberty-suppressing hormones, all continued with the actual sex reassignment, beginning with feminizing or masculinizing hormone therapy. Now I'm going to pass it back to Kaylee.
All right, so we want to talk a little bit about trauma treatment and the social supports. And so we always want to make sure that families are supported in managing any uncertainty or anxiety about their child or adolescent's kind of gender identity outcomes, and then also how to help these develop a positive self-concept. So again, meeting the families where they're at and making sure that how they're responding is in a way positive for the child's self-concept. We really want to make sure that mental health professionals don't impose a binary view of gender, like allow ample room for clients to explore different options for gender expression, hormone or surgical intervention may be appropriate for some clients and not for others. And so giving the client and their family room to explore that, to kind of see what fits best for them and where they feel comfortable along the spectrum of variety of care is the best practice. We also want to make sure that clients and their families are supported in making the difficult decisions regarding the extent to which clients are allowed to express their gender in a way that is consistent with their gender identity. Also, like thinking about this is what are the timing of the changes for their gender expression and possible social transitions. So if you have a younger child who's maybe still in middle school or high school, like how might the child want to attend school while undergoing a social transition? Do they want to wear different clothes? Do they want to have a different hairstyle? Do they want teachers or their peers to use a new name or different pronouns that are congruent with their gender identity? These are things, and these can be difficult issues, whether and when to inform people about the client's situation and others in their lives. We want to work with families on how they can support their child's transition in a way that is safe for them and for the family. And if you're working with older children or young adults or adolescents, we want to be conscious of kind of how is that going to impact their ability to get a job, their peer groups, and what's going on with their kind of ongoing education. Those are just all things that should be a part of the conversation, and as providers, we want to make sure we're having kind of those difficult decisions with people and finding supports for the client so that if they're not comfortable addressing those challenging conversations either with family or friends on their own, that they have someone who will support and affirm their identity to be there as a resource for them. A lot of times health professionals are acting in a way as an educator or an advocate in which you might be reaching out to teachers, school boards, you might be helping to locate attorneys. All of these things are different things that you can do to help the client and their family learn about what rights are available to them and kind of how to make sure that their needs and desires are expressed. And so as a professional, we strive to maintain that therapeutic relationship with our gender-expansive and trans youth and their families. And so we want to look at kind of what treatment modalities are going to be best for them and how can we work to make sure that they will continue to receive ongoing care throughout any of the social changes, physical interventions, or things that may occur later in life for the client. And with that, I will turn it back to Sabrina to look at a few more affirming practices.
So when we look at affirming practices overall, we really want to highlight and hold up the core concept of the importance of physical and psychological safety. So as I touched on a little earlier, really looking at our physical spaces and do we have gender-neutral bathrooms? How do our waiting rooms look if you have a transgender or gender-expansive youth and family coming in? Do they speak to their life and their identity? Are our organizations and our space really clear about what the organizational policies are, about non-discrimination, about confidentiality? And how do we ensure that those things are communicated to our youth? Ensuring that our bulletin board announcements don't just highlight the heterosexual or heteronormative events that are happening, but that they celebrate kind of the true range of identities related to gender and sexual orientation. Taking a look around our personal offices and how do they look, how do they communicate, or what do they communicate? And I think part of affirming practices is, particularly with transgender and gender-expansive youth, is to ask the youth, do they feel safe in our space? Are there things that we could do, whether it's our office or the broader physical space, that we could do that would help them feel more safe? We've spoken a little bit about the range of language, and so as families begin and move through our intake processes, do we have inclusive language, particularly on our different forms? Is there opportunities for youth to identify the name that they wish to be called, and that we somehow note that, and that is what staff at all levels refer to that person, and how do we note it so that the person who may do reminder calls or the person they check in with knows that this is the name that person wishes? What are their preferred pronouns? We'll talk a little bit more about those. How do we document those, and how do we know that this is what this individual wants to be referred to as? And not only us, but again, looking across individuals who may want to, or who may be working with that youth or interact with them, if the youth and family are comfortable with that. Do we ensure that there are, when we ask about relationships, that we provide options? And do we describe or have options to describe parents' relationship? So looking at how, specifically or more concisely, looking at exactly how do our forms and intake materials consistently allow individuals to describe their gender identity. And that information about documentation, privacy, and confidentiality is not only available, but it is a part of a conversation that providers have with transgender and gender-expansive youth who may be out to different people in different ways. Next slide. So as we move into the intake interview, ensuring that we're not making assumptions about a person's gender based on how they look to us, as we kind of highlighted at different points in the presentation, or their sexual orientation. That we allow for a full range of people, that they may be, full range of possibilities for who is the person interested in dating, or who may they have dated, and that we don't make assumptions based on how they appear. Part of our intake process and assessment, as Andrew talked about, really should also include screening for traumatic experiences, particularly those that we know that transgender and gender-expansive youth may be more likely to experience. And so a little while later, we'll talk more about the screening of the intersection in trauma and sexual orientation and gender identity for all youth, something that we are very excited about, that will be rolled out soon, that speaks more to those experiences. So again, quickly ask about a significant other or partner who they're interested in dating instead of a dichotomous binary, and then screen and include that as part of your assessment process. Again, as Andrew spoke about, or next slide, that we want to assess for the role of co-occurring mental health concerns, and then include in our conceptualization how or if sexual orientation, transgender, gender-expansive identities may have been affected by traumatic experiences, and recognizing that those may be part of a cultural issue of how the youth or family identifies, and not necessarily something that they need to bring into treatment. In other situations, transgender and gender-expansive youth may need some of those issues to be a central part of treatment as they try to navigate our social landscape and address some of the discrimination and traumatic events that they may experience. Next slide. So this slide introduces some of the more common pronouns that we see transgender and gender-expansive youth identifying as. And this is one of those things that changes on a regular basis, and it's also personal. So really asking that person that you are working with how they identify, recognizing that how they identify may change over the course of treatment. And so having some idea of reassessing or re-asking, is this still how they want to be referred to? And I think it's important for individuals to practice with pronouns in working with people so that they become more natural and more just slip into easy parts of the conversation. And so we're not communicating that it's a struggle for us. There's a link in the PowerPoint that also looks at some additional pronouns people may be using. And again, this is an area that I spoke about earlier. How do we communicate that to other individuals if the youth is comfortable with that? Next slide. So this just looks more at things that we've spoke about earlier. And one of those is allowing the process of gender identity to unfold for both youth and their families. So really having that be a part of a conversation rather than this is how someone identified when they came in, and we're still interacting with them in that same way 6 months later, even though they may have moved in the process. And this also speaks to some of the issues about the different types of transitions that we understand that those are a process, and thinking about those, whether it's social transition or medical transition, that those are things that some individuals may wrestle with, and we recognize that it's going to be different over time, and that youth and their families may be in different places regarding acceptance or what next steps they may want to take, if any. We've spoken a little bit about how confidentiality is tied to affirming practices, and really being clear about what is confidentiality like when working with coworkers? How do we communicate confidentially to the youth and families that we're working with? How do we document, particularly in light of the idea or our knowledge that identity may be something that changes through the course of treatment, or that individuals may be seeing us because of how identity and their mental health issues co-occur. That we recognize that youth who identify as transgender or gender expansive may be more comfortable talking with that, or more out, so to speak, to some providers than they may be to people in other systems that they're working with. So again, being cognizant of our documentation, but also really respecting the confidentiality wishes of the youth. That if we want to highlight and try to get support or emphasize the importance of support from senior administration, and have senior administration be aware of what affirming practices are. Again, this helps us keep things more systemic in nature rather than just being provider dependent. And then what is the support that we give staff for continuing education, for working with the particular difficulties and challenges that our transgender and gender expansive youth may face. And so we both have knowledge in terms of support and staff, and also working to reduce secondary traumatic stress. So a quick overview of some of the highlights affirming practices that we have interwoven throughout our presentation. As we move to the next slide, this is where we just laid out some of the familiar terms and definitions. Again, we've provided some other resources for those. And the affirming practice highlights is becoming familiar with terms, recognizing that we work with the whole person, and that we also want to be curious about what those terms may mean to the individuals that we're working with. So we've talked earlier about sexual orientation, gender identity, and gender expression. And so if youth are identifying that we do want as transgender or gender expansive, that we need to know what that means for that person. The next slide talks about, again, some of those other issues that we've spoken about. So we really work, and our society runs much more on a binary system where gender and sex are really dichotomous from each other. And that in working with gender expansive and transgender youth, that we really want to look at gender as a fluid and more self-defined. Next slide. Again, looking at some more definitions related to transgender, cisgender, or non-binary, and recognizing that new terms and language come out constantly, and it fluctuates with the times, that kids may be abbreviating words, that they may be talking about things that in one area of the country that is unfamiliar in another area. So again, that importance of really meeting the client where they're at. Next slide. So it looks like, I'm sorry, I got ahead of myself a little bit about recognizing terminology is changing. So we've spoken about some of these before. They're on earlier places, but we wanted something to have as a reference for you. And then next slide. So again, that transitioning in terms of the various different processes and levels, queer is a broad term, or questioning. And I think that's a population, again, that our curiosity and support is important. And then we do provide the link to the Trevor Project, which is where the definitions came from, and you can see more definitions and more definitions. So next, we want to introduce and say a few more words about our screening for gender identity, sexual orientation, prevalent traumas, and risks for LGBTQ youth.
Okay, great. So as we referenced throughout the presentation today, we've been hinting at this screener we've been working on here, and this truly is a labor of love that a team of us within NCTSN have been working on for close to 3 years now. And it's a group of providers and researchers who have focused on working with LGBTQ youth with trauma for quite some time, and working to recognize, as we've been talking about through this presentation, the disproportionate risks for these young people, and that often providers, as part of routine intake processes, aren't having these conversations about sexual orientation and gender identity and even trauma with young people. And so this screening that we've developed and will be rolling out soon is really a way to start that conversation with a young person and their family. And so, hint, hint, we'll be having a webinar on this on December 11th. So you'll learn more about it then. But just to give, kind of a brief teaser about it, the screener really is intended to be used for all clients. As we've been talking about throughout this webinar today, we don't want to make assumptions about a young person based on certainly their gender expression or physical appearance when they present to us, and assume that they either are or are not LGBTQ identified. And so the intention is to use this brief screener for all young people who come through mental health settings and with their caregivers. And so it's structured with kind of a brief overview of the importance of it and some of the data that we've been talking about today, so that you can, in your setting, realize, and share the importance of screening for this information, and talk with clients and their caregivers about why we're asking these kinds of questions and why we'd be asking this of all young people ages 7 and up. And again, it's intended to be a conversation starter. So this isn't a structured clinical interview. This isn't, kind of true, symptom or data collection, that sort of thing. But what we're asking about are somebody's name, their pronouns, what language they would use to describe their sexual orientation and gender identity, a little bit about their dating activities, and then a brief screener about traumas that they may have experienced related to their sexual orientation or gender identity. So hitting some of those key areas that we talked about in the data earlier in this webinar, and making sure that we screen for those experiences that we know that these young people tend to be at risk for more than some of their other peers. And so again, this is done separately with the youth and their caregiver, because we recognize that some young people are not out to their caregivers. And so we want to have a safe space for them to be able to share information. And it's also really relevant in terms of the treatment planning then. If there are key aspects of this young person, either their orientation, their identity, or trauma experiences that their caregivers don't know about, that's really important for us to have in terms of developing a treatment plan. And so being able to have conversations with the young person about, confidentiality of their information, as we've talked about so far, while also, of course, keeping in mind any mandated reporting requirements that we have if a trauma is revealed that has not previously been reported. But we really, again, we will talk much more in depth about this screener and the ways to use it and the questions involved in the December webinar. But we do hope that this will be a great conversation starter and a way to help our LGBT youth broadly, but also specifically for the young people that we've been talking about today, those who identify as transgender or gender diverse in some way, a way for them to share some of their unique experiences with us, and for us to start at an intake and setting up a safe and affirming environment where they can talk about those experiences with us.
Thanks so much, Megan. As Megan was mentioning, we do have 2 upcoming webinars. One is on November 20th, which is about implementing trauma-focused cognitive behavioral therapy with LGBTQ youth impacted by trauma. and then the one on December 11th about the screener that Megan was just describing. On this slide, you also see an email to sign up for our NCTSN e-bulletin, which will announce these different webinars and when the official LGBTQ screener is launched on our website. And as just a reminder, there are lots of different resources for folks to access on our website and on our Learning Center. Two that I'd like to highlight very quickly is the hot off the presses recently released Implementing TFCBT for LGBTQ youth and their caregivers, and that will be the focus of the November webinar. And then another one that, again, hot off the presses is Sexual Health and Trauma for Providers, which really focuses on how to have some of these conversations, the wheres, the whys, the how, and giving some examples of how to start what can be some pretty complex conversations. And finally, quite a few folks asked about resources, about locating providers. This whole slide deck will be available on the Learning Center once it's posted in the next couple of days. And one of those resource slides is about the identification of providers. These are the 5 resources that we think will be most helpful to folks. And then there are also references to a lot of the different studies and resources that we referenced and all of the different web links. So I hope that folks didn't think that they had to write everything down, because all of this will be available to you. I would like to move us on to our question and answer portion. So please make sure that you've put your questions in the Q&A box. We will have about 15 minutes or so. And I'm going to hand this over to our presenters. Megan, you specifically talked about, some of the data around the experience of youth in schools, and certainly everyone can answer this question. But one question we have is, how can I help my school become more trans-friendly?
It's a great question, and thankfully there's lots of good resources for this. So Gender Spectrum is a fantastic resource that has basically a whole toolkit specifically for schools and administrations about how to have safe schools. There's also safe spaces. So, again, you can do sort of some online trainings, do some curricula, do some in-person work to designate a safe space for kids. And so I think that, it's always going to be about education and learning and an openness to do so. I certainly provide those resources to schools myself, and then I often offer, if I have a client who's at a particular school that is open to receiving more information, I'll offer to go do, a talk for the teachers for free, or I'll do a consultation, or I'll go to a Section 504 meeting or a special education art or something like that, and talk about, if the diagnosis of gender dysphoria is applicable, then I will talk about that diagnosis and talk about the things that they can be doing on a school campus that will decrease a young person's experiences of gender dysphoria and therefore decrease their risk factors for other mental health conditions. So I always frame it that way to schools, is that whether you feel like you understand a lot about transgender and gender diverse young people, that all schools want safe and healthy students. And so as I talked about the data, there's kind of direct applicable outcomes for academic performance. And so I talk with schools about the impact on academic performance, on their student safety and well-being, and that getting this information and putting these things into practice on your campus is going to help this young person succeed.
Thank you so much, Megan. Any other responses to that question?
I'd say something that I've seen in my experience when working with kids in either therapeutic schools or just traditional schools is that when the school has had a GSA, so a gay-straight alliance, that also really did a lot of work on advocating for trans and gender-expansive youth to feel included, the youth there did express feeling like even having that one staff member who was a member of the group or having their peers who they could count on, those were really great resources for them, and they did feel more safe and comfortable in their schools, which in turn improved their academic outcomes. And I believe, and Megan, maybe you can confirm this, I think GLSEN has resources on how to get started with your school's own GSA.
Yeah, I think that's right. Actually, GLSEN's got a wealth of resources. Thanks, Kaylee, for mentioning that too. They, in addition to their survey of students, they do surveys of school personnel and school counselors. And so they do have lots of fantastic resources for how school professionals can support young people on campus.
Wonderful. Thank you both. So this is a question that's going to resonate with everyone. From one of our participants who works in a pediatric unit, they'd love to know what all of you recommend when you have a patient who identifies as non-binary and wishes to be identified in a particular manner, but their caregiver/parent insists on their at-birth gender and given name.
So I think, this is Andrew. I can speak to that a little bit. Even in, I work in outpatient mental health, and that issue does arise. And the way that I've handled that is to try to minimize, like if I'm talking to the parent, try to minimize having to have the kid in the room, so that when I'm talking to the parents, I can be respectful of the parents and use the language that they use. However, when I'm with the kiddo, I will go with what the kid wants. This can be a really tough thing to sort of navigate through, because there are going to be times where you have to meet with the parents and the kiddo. And so what I've done in the past is have a conversation with the kiddo, letting them know, look, when your parents are here, you may hear me say things or refer to you in a way that's not, that may not feel good. And I want you to understand that I'm not doing that because I'm challenging who you are or I don't believe who you are. I'm doing it because I want, and essentially I want to appease your parents, because your parents are the ones that brings you here, and if I don't want to jeopardize the opportunity for you to continue coming here. Hopefully that makes sense.
And to follow up on what Andrew just said, also this is Kaylee, just to work with the parents on understanding and really like having that conversation with the young person that treatment always isn't just work with the child client, but also with the family and the parents, and letting the young person know, like, I'm not just working with you around this issue, like I'm also working privately with your parents, because a lot of times when kids see the aspect of, okay, this is also changing my parents' perceptions, they're more willing to be patient or to listen to what may be coming out of treatment with their parents.
This is Megan, and one other thing I would add, and I have the luxury, I'll say the luxury and privilege to be in my own private practice setting, and so on my website I state I provide affirming care for LGBTQ youth. And so parents probably know and might select out rather than getting to me if they're not ready for that. But I do have some who are struggling more than others with language, and it's having a conversation with them about the importance and about the fact that we now have research and data that tells us that using a young person's name and pronouns, actually that in and of itself does help mental health outcomes. And so I talk with parents openly about that when when your young person's telling you that I want to use they, them pronouns and I want you to use this name for me, doing that will help in some ways more than my treatment might. And so I talk about that just really bluntly using data, and I think that that's a really good way to provide some support to the young person and to be gently nudging parents. Now, I'm respectful of their language as well, but I will also often have a conversation with parents saying, your young person has told me that they use they, them pronouns, and so when they are present, I'm going to be using those pronouns. So I'm honest not just about with the kids, what I'm saying with parents, but I'm upfront with parents saying this is the language I'm going to use, and I understand you're not there yet, but this is what your young person has asked me to use.
And this is
I think also a good go ahead, Sabrina, sorry.
My practice is to echo kind of what Megan did, but I also think there are times and certain settings where we need the youth to engage with us and explaining to parents, like, I understand that may be, as Megan said, something that you are struggling with right now. Your child is here for X, depending on the setting that you are interacting with them in, and to best accomplish X and to kind of affirm who they are, this is what I'm going to do. How your struggle with that may be something that may be a topic for someone else, or so I think there's also looking at what's the purpose of our interaction, and highlighting that sometimes getting the parent or getting the child and adolescent to listen and engage with us means that we are perhaps contradicting their parents a little bit.
Yeah, and to follow up on that, like also kind of having that conversation with parents about like, well, who are their supports? Who are their resources? Who can they talk with? I often have connected parents with PFLAG, offered books as resources, kind of online communities to say like, you know, you're not the only one in this situation. There have been other parents who have struggled before you, and how can you learn kind of about what this is going to do to impact your life? Because we know that our parents' challenges around gender identity often come from such a deep and compassionate place where they care for their child. And so how can we get them to see how their actions can still be compassionate and caring and affirming for their young person?
One last thing to add, and you know, it's not always possible to do this, but like in our setting at our clinic, we have a parent support group for parents of transgender, gender nonconforming. It's open to, there's no age restriction, like it doesn't have to be a youth, or it could be an adult, but sometimes when you get parents together and parents who might not be as accepting or affirming are listening to parents who are accepting and affirming and hearing how you know, how much better the kiddo is doing or how beneficial that affirmation and support is, can be like a means to get the parent, that non-affirming parent, to sort of move more towards affirming.
We have a wonderful follow-up question. Since the pronouns are constantly changing, what is a good way to let your client know that you're respectful of what they want, but that you might get confused and confuse them while explaining something?
I think that's a great question.
Go ahead, Megan.
I was just going to say, I invite the conversation at the beginning, and I tell young people, you know, when I ask them their pronouns and share mine, and I say to them just like, hey, just so you know, if you ever change pronouns or want me to use different pronouns, just let me know, and I'll roll with the punches and we'll switch gears. And if I make a mistake and I don't catch it, let me know, and I'm going to apologize and try to do better. And so it's having that be stated explicitly, I think, and inviting that to be an ongoing conversation that has worked well for me.
I think Megan eloquently said everything that I was going to say.
Thanks.
I'll say, this is Kaylee. I've sometimes actually started sessions or groups with kids to say, hey, we just want to refresh, like, what are everyone's pronouns today? Because I've also worked with young people that maybe one day they were feeling a little more masculine, maybe one day they were feeling a little more feminine, or because they were kind of beginning their own social transition, there would be days where they felt comfortable with some pronouns and maybe not other pronouns. And then the next time I would see them, it might be a little different. And so that's something that I normally would just start out like, hey, where are we at today? Like, quick check-in, what pronouns should I use? And the young person would be like, oh, I would like you to use he, him, his today. And we would continue on. So it really was about making it that just like natural dynamic in our sessions and in our time together, that it would be like, yep, pronouns, first thing, cool. And I often will have things like up in my office that say like, don't forget to ask about pronouns or ask about my pronouns. And I actually like have my own little pin that says she, her, hers for my pronouns. So it's like making sure that, you know, starting that conversation and saying, oh, if I don't get it right, let me know. And always feel comfortable like to say like, oh, I messed up, I'm really, really sorry. Like, can we start again? Like, I'm going to do better. I think that goes a long way with young people. They can tell when we're trying and when we want to do better.
Any final comments about this question before we move on? Okay. There's been a couple questions about medical referral, and so I'm going to ask you guys for a little bit of clarity. If you could talk a little bit more about the reasons why you would refer a client for a medical evaluation.
Who wants to
Refer them
start?
for a medical evaluation for what?
Well, there was some confusion about were you referring just for an evaluation for dysphoria or?
I mean, I think there's a lot of different referrals you could do. Go ahead, Andrew.
Yeah, I was just going to say, I mean, a mental health professional can assess for gender dysphoria and provide somebody with a diagnosis of gender dysphoria. I wouldn't necessarily, I wouldn't refer someone that came to me to a medical provider for them to assess for gender dysphoria. In the standards of care, in the WPATH standards of care, if somebody wanted to go on hormones or get gender confirmation surgery, one of the standards of care is that they have a well-documented history of dysphoria. So they come to me, I diagnose them with dysphoria, and then they might say, okay, well, I want to go, I want to go on hormones. So I might refer them to a doctor who can provide hormones, and part of that referral process might be verifying that they do have a diagnosis of gender dysphoria. Hopefully does that clear it up at all?
Absolutely. Thank you, Andrew. That's perfect. Any other comments about that question? Okay, I think we have time for just one more. Oh, sorry, go ahead.
Well, I was going to say, just in practice, like if you are regularly assessing young people or young adults for gender dysphoria and then engaging them in a medical transition or helping them engage, making sure you're familiar with a provider, making sure you can answer their questions, like that's all a part of the WPATH standard, and it helps to know like who are the more affirming medical providers in your community. So you're not just making cold referrals and sending clients to someone you don't know.
Thank you.
And I was going to just say the one other thing is that I think probably more than any other area of my practice, coordination and consultation with endocrinologists, general practitioners, adolescent medicine specialists, and psychiatry is something I do on a very routine basis with my transgender and gender diverse young people. And so kind of piggybacking off what Kaylee said, like sort of knowing those providers, and you form a very small network of providers often, even in very large cities like where I am, of those people who provide gender affirmative care. And so you need to be in close consultation, because if you have kids doing things like, blocking puberty or starting hormones or things like that, there can be mental health consequences, good and bad for those, and so you want to be coordinating with those providers around, those medications and what you might be expecting to see to support the young person and their family.
Well, I'd like to thank Kaylee, Andrew, Megan, and Sabrina for their wonderful presentation, and thank you all for answering these complex questions. For our participants, please remember to log onto the NCTSN Learning Center and complete the evaluation and the CE post-test for this webinar. I'd like to thank you all for joining us and engaging in this really important topic, and this concludes today's webinar.